Well, hi, everyone. Thanks so much for joining us for this week's Snack and Chat, Adopt for Life's Facebook Live, where we explore topics that are top of mind for families formed by adoption, kinship, and customary care. My name is Chantal, Community Engagement Liaison with Adopt for Life. As always, I am here to just monitor the chat. I'm going to post some links and maybe some key takeaways. Today, Nancy Lockwood, our guest host, is back, FASD consultant and educator. Hi, Nancy. Thanks again for jumping in and being our host today. Our guest, Dr. James Reynolds from Kids Brain Health Network. Welcome. Whether you're watching live, maybe you're watching this later on replay, thank you for taking time to be with us. Feel free to ask questions or post a comment in the chat. I will just take a moment to remind you that because this is live streamed on our public Facebook page, the information that you're sharing in the comment or in your question is publicly available. So please be mindful and not include any identifying information if you're asking a question about a minor. So thank you. With that in mind, we do love hearing from you. So we hope that you find this discussion informative and engaging. I'll just take a quick moment to introduce Dr. James Reynolds, a professor in the Department of Biomedical and Molecular Sciences and the Center for Neuroscience Studies at Queen's University. His interdisciplinary research program has included both basic and clinical investigations focused on the effects of prenatal alcohol exposure on the developing brain and the resulting cognitive, behavioral, and socio-emotional deficits that may occur in children. From 2010 to 2020, Dr. Reynolds was the program lead for the Fetal Alcohol Spectrum Disorders Research Program in the Kids Brain Health Network, a national network of centers of excellence dedicated to the study of neurodevelopmental disabilities in children. In 2018, Dr. Reynolds was appointed as the network's chief scientific officer, in which role he provides scientific leadership to an interdisciplinary network of researchers, clinicians, parents, in both private sector and not-for-profit partner organizations who work together collaboratively to improve outcomes for children and families. So a big thank you to Dr. James Reynolds for taking time to be with us today. We appreciate it. I'm going to just hand it over to you, Nancy.
Okay, thanks, Chantal, and welcome, Dr. Reynolds. I actually had the pleasure to work with Dr. Reynolds the last 6 years when I worked at Able2 for the Fetal Alcohol Resource Program. So I think I even earned the right by now to call you James, if that's okay.
I would prefer it, Nancy, yes.
I know you would. So let's get started on some of the questions. As you know, I'm a big fan of Kids Brain Health Network, and one of the main reasons is because I love how you value the voices of caregivers and people with neurodevelopmental disabilities, as well as researchers. And I love how you bring everyone together. So as Chantal was saying, Kids Brain Health Network is a national network of researchers and health professionals whose focus is on helping children with neurodevelopmental disabilities and their families. So James, can you talk a bit more about the work that Kids Brain Health Network does and your area of focus with your research?
Yeah, happy to. I mean, I'm always happy to talk about the network, and thank you very much for the invitation, the opportunity to share some of our story with you. It's been an interesting journey over the last 11 years now. When the Kids Brain Health Network first started as an NCE, we really had much more of a focus on basic biomedical science and experimental work, and that over time has evolved to a greater understanding of the role we play as researchers in addressing the needs of children and families. And the evolution of our thinking has moved away from researcher-initiated, curiosity-driven research, which I'm not saying that that's wrong, but to actually looking and asking children and families, what are the challenges you face on a daily basis? And we use that type of stakeholder engagement as the driver for the work that we fund. We want our research outputs, our innovations to directly address the problems and challenges faced by kids and families on a daily basis. And that in turn has led to our greater involvement with partner organizations, where this is where the families are coming to contact in their lives. So this is where we need to make our research live, is with those partner organizations, creating new tools and innovations, and then working with service providers to make sure that those discoveries actually reach children and families, which has been a huge problem. So the Kids Brain Health Network, in a nutshell, is there to serve as the link between research discoveries and innovation and the children, families, and service providers who can use that information to improve outcomes.
Okay, well, thank you. And I know over the last 20 years, your research interests have centered specifically on prenatal alcohol exposure and its impact on brain function. Can you tell us about your research related to saccadic eye movement as a tool for assessing sensory, motor, and cognitive function, areas that are often impaired in kids with FASD, and how could this information benefit families?
Yeah, I mean, it's an interesting story in itself, in that this was an area of research I got involved in, not because it was my own background or training, but because I challenged myself to get involved in research that would have that more direct translational impact. And it was I was very fortunate to be able to collaborate with a colleague here at Queen's University, Dr. Doug Munoz, who is a world leader in the use of eye movement behaviors as a way of quantifying brain function. So Doug and I collaborated on the first ever study back in mid-2000s on using saccadic eye movements and measuring eye movement behaviors in children with FASD as a way of assessing brain function. The original questions about could we actually do this very, very rapidly evolved into a program of using eye movement behaviors as a way to quantify brain function and to demonstrate in a truly a visible way the nature of the brain injury in children with FASD. You can look at the eye movement traces, and I've used these in several presentations. You can look at the eye movement traces of a child with FASD compared to a typically developing child, or even a child with another developmental disorder such as ADHD, and you can see the differences. And then it makes it real for people when they can understand and see. And when we presented this type of data to government decision makers, they get to see it. It becomes real to them that there is a brain injury here, and it's easily identifiable. So where we wanted to go with this is to create additional tools that could help in the assessment process by again objectively and using computational tools to in part automate the collection and analysis of eye movement behaviors that could feed into the diagnostic assessment process. That's gone much slower than I would have wanted, but it's still very much on the horizon that these technologies will become more accessible for clinicians and health practitioners to use. We've already seen versions of eye trackers that are you can use on tablets or phones. So the technology is rapidly evolving to the point where these approaches will become, I think, more commonly used, and I say more accessible and cost efficient. That will give us these additional tools for helping to identify and differentiate different types of brain injury in different clinical populations.
So on that same sort of note, why is early identification so important with neurodevelopmental conditions?
Yeah, so this is something we've suspected for a long time, but now I think we have clear evidence based on years of longitudinal follow-up on children with FASD is, and it comes back to a key principle. Prenatal alcohol exposure is just the first insult, the first injury that occurs in a child. It doesn't happen in a vacuum. There are so many other things that go into that outcome, including we now recognize it's very strongly influenced by the early postnatal environment that the child is living in. And we know without a doubt that the more stable and nurturing that early environment is, we have the greatest opportunity to mitigate the frequency and severity of adverse outcomes for that individual child. Conversely, if that early postnatal environment is not nurturing, if that child is subjected to additional trauma from abuse or neglect, that in turn will drive outcomes towards more serious consequences for the mental health and development of that child. And all of this is related to what we understand about early brain science. The first few years of a child's life is when the brain is developing at a rate that's not matched by any other stage of development. And the brain is very responsive to that environment in which the child is being raised. And we know that the child's early experience is what is foundational for establishing neural networks in the brain that will underlie future function, including cognition, attention, self-regulation, and emotional health.
Right.
So those first 3 years are the critical period when we have the greatest opportunity to set an individual child on a trajectory for better outcomes. And that's it. It's when we don't take advantage of that. It's incredibly frustrating for families. It's frustrating for anybody who works in the field, because we're losing an opportunity to affect that child's developmental trajectory.
And one of the issues is barriers to diagnosis, particularly with FASD. So particularly in the Adopt for Life community, many of their families are adoptive, kinship, or customary care providers. And does that influence barriers to identification as well, or barriers to diagnosis?
Yeah, I mean, we have lots of barriers.
Yes.
And we can start with just capacity. We don't have the capacity in Canada to make diagnostic assessments for any more than a small fraction of the children we know are affected. So getting access to the type of multidisciplinary clinic or clinical team that is best suited to make an assessment for FASD, that's the first barrier, because they're rare, relatively rare in this country, and that creates the first barrier. If you can't even access diagnostic services in your region, that's the first strike. There's a poor understanding, still a relatively poor understanding of FASD by healthcare practitioners in general, and that's that. So that even that early identification and referral is problematic. Then there's the issue of knowing the prenatal history.
Yeah,
and,
exactly.
And in the absence of overt physical features of prenatal alcohol exposure, confirmed prenatal alcohol exposure is a requirement for the diagnosis. So everything else, every other element can be in place. But if you don't have that critical last piece of information, then a diagnosis can't be made currently under our current guidelines. So this is a story I've heard many times for a family who adopted a child, sometimes as an infant, often as an infant. And it's only when the child first goes to school that behavioral problems and issues start to emerge. trying to backtrack on the child's prenatal history at that point is almost impossible. So getting that prenatal information on substance exposures becomes yet another barrier to diagnosis for many families. So we have lots of issues when it comes to accessibility of the diagnostic process, and therefore, again, because diagnosis is then linked to treatment, families are blocked, essentially blocked from accessing the services and supports that they could benefit from because they can't get past that first step.
Yeah. Well, let's move on and talk about some of Kids Brain Health's programs that are benefiting families with children with FASD, whether they're diagnosed or not diagnosed. So first, because it's dear to my heart, Able2's Fetal Alcohol Resource Program was launched in 2015. It was a collaboration with Kids Brain Health Network, CHIO, the Children's Aid Society of Ottawa, and Able2. And now it's actually grown into one of your cycle 3 projects, and it even was the basis of your Navigator program. Can you speak about the program and how you saw it as benefiting families and why you thought it could apply for the Navigator program?
Yeah, happy to, because as I said, I was around from the earliest days, and I still remember having a conversation with Brian Tardif, and he phoned me up one day and was talking about this idea that had emerged from his conversations with families in the Ottawa region, and to me, it was a natural fit. It was the type of program that I felt the network had actually been set up to create, because it was a problem that had been identified by families, and the question was asked, what do you need? So we need a program that connects families to the services that exist, because there are lots of agencies, there's lots of supports that are available in communities, but they seem to be behind some opaque curtain, and families are just, it was impossible for them to access them. They didn't know who to ask, who to approach. Sometimes the agencies themselves they were often siloed, and a family would approach one, they wouldn't be aware that there were other services or more appropriate services for that family that existed elsewhere in the community. So there was this chasm, if you will, this disconnect between the families on one side with their needs and the service sector, which had been set up largely to address those needs. They were not connected efficiently for so many families. So this was the need that was identified. And so the program that was set up was designed purposely to fill the two sides of that equation, supporting the families on the one side, but also educating the service sector, so that when you ultimately then connected a family with the sector, they were prepared with the right information to properly support those families. So it addressed a knowledge gap,
Right.
and as you said, the program was essentially initially set up as a 2-year pilot, but rapidly it became apparent that it was filling a real need within the community, and so that translated into more ongoing support and growth and expansion of the mandate of the program to deliver more direct clinical service, support groups, start to expand its influence, as you've seen, to connect with the Ontario Provincial FASD Strategy through their FASD support worker program, support those individuals with information and evidence that they can then use in their own positions to support families. Everywhere we went, we talked about this program, and I'm sure this was your experience too, Nancy. Everywhere we went, and we talked about this program, we would hear from individuals in other communities, we need that. That's what's missing in our region or in our community. Where can we go to get that? So it seemed that we had hit on a program, a formula, if you will, that was resonating with communities in different parts of the country. And I should say, again, another story going back several years, I was talking to a community group about FASD, and I raised this question about, we can connect you, if we have to identify children in order to connect them to services and supports. And one mother put her hand up and said, I am an educated professional. Where are these services and supports you're talking about? Because I can't find them in my own community.
Right.
So again, I heard this at a very early stage, which is again one of the reasons I was so keen to get involved in this initiative when it was first suggested. So having that evidence that not only was this program efficiently addressing a need by not creating anything new, and I want to make sure that we emphasize that we weren't spending a whole lot of money to create new things.
Right.
What we actually were doing was spending a very, very small amount of money to make what already exists work more efficiently, more effectively for the kids and families who needed it. So, from a cost benefit perspective,
yes,
the return on investment of programs like the Fetal Alcohol Resource Program is immense when you actually look at what it's doing versus what it costs. So having that evidence, we had an opportunity to apply through another charitable foundation for support for a program that we would then establish in the network. And so we used the experience of the Fetal Alcohol Resource Program and the broad community partnership that had come together to put it in place and to monitor its activities. Use that as the model to propose a more expansive program, which ultimately was funded and is known as our integrated navigational support program. So it's funny, the original idea of let's just we'll replicate FARP or some version of FARP in these other regions quickly morphed into something quite different, because just as the Fetal Alcohol Resource Program was set up to address an identified need in its region, what we found elsewhere is that we had to first listen to the local organizations, the local stakeholders, to identify what they needed.
Right.
What did they have? What did they need? What improvements in system processes would best serve their populations? And so what's interesting is over the years, what's evolved in the three regions that in which we set up this program is three very distinct entities that have evolved with mandates and programs that were identified by the local stakeholders as being what they needed. So when programs are responsive in that way, so bottom line, there's no formula, there's no recipe here other than listen. And I can't emphasize that enough. We have to listen to the needs of the local organizations and the local families. We need to understand the system, the ecosystem in which they live, and how best to help them improve their circumstance, their situation, to address their needs.
So on that note, how do you see the Better Nights, Better Days program to support sleep as beneficial in the FASD community?
So this is going back to one of our earlier conversations about a program that is not, or an intervention that's not necessarily specific to a single disorder group, but was purpose-built to be a transdiagnostic intervention for children with neurodevelopmental disabilities who experience sleep disruption. And since that happens in about 90% of the kids with a neurodevelopmental disability, it's a big group. And so we know that sleep is disrupted in kids with FASD. This has been studied and quantified And we know when you know, all the parents out there know that when your children aren't sleeping, either are you.
Yes.
So there's a big impact, not only, but sleep, sleep is restorative, but sleep is also a critically important aspect of our development
Right.
early on. Healthy sleep and healthy restorative sleep is critical for helping the brain develop in those early years. So there's a real consequence, negative consequence on brain development, and for not trying to normalize sleep patterns in these children. Plus, it's incredibly disruptive to the family. It contributes to family stress, and you know, parents need to be healthy themselves in order to care for their children. Yeah, but that's often lost in the discussion.
Exactly.
So the Better Nights, Better Days program was an adaptation of an intervention that had been developed to help support sleep in typically developing children. It's currently in the final stages of a randomized clinical trial to evaluate the efficacy of the program for children with neurodevelopmental disabilities. The anecdotal reports that we've heard from families is that it's been very effective for them. So I expect that once this program becomes more widely available, and the team is working on a model that will see a more direct consumer accessibility, that is not having to go through the healthcare system to access the program, but being able to access it directly. That more families will be able to benefit from a structured intervention, information, and support to improve sleep hygiene in their children.
Another one of your programs that I think is so intriguing is Dino Island, your therapeutic video game. How can that benefit children with neurodevelopmental disabilities?
Okay. So here's one that was the opposite. This was an intervention that was actually first developed for children with FASD. It came out of the University of Victoria. I distinctly remember visiting with Kim Kearns, one of the developers of the program in its earliest version back in 2010. And she was showing me the program that was based on psychological tests, but she had turned it into a game. And it was a game that was supporting the development of cognitive abilities, particularly attention and memory. That was the purpose of it, was to support the development and strengthening of those skills in children with FASD. The program has gone through several iterations of development and testing. They've done clinical studies with over 2,000 children over the years who experienced the program. It was aimed initially to be done in a school setting, so educational assistants could work with an individual child in the game. It's what we call a serious, because they just don't play the game, but as the child learns about the game and acquires skills, the game gets more difficult. So the game automatically analyzes how well the child is doing and adapts itself to the skill level of the child. So it's always pushing a little bit, but increments, not making you leap, but taking steps in developing your skills and approach. And it's been shown to support improved cognitive abilities. But what was interesting is that when this was done in school settings, we frequently heard, or the research team frequently heard, that the individual children who had gone through the trial with the game were showing improvements and gains in other aspects of classroom function and behavior. So there was some transference of the improvements in cognitive skills into other aspects of classroom activity that were also seen as being beneficial. So what the research team has been doing over the last couple of years, particularly in light of COVID, is pivoting so that the program is available online, and expanding the scope, the target audience, to go beyond schools, so that we could actually think, or they could actually think about direct delivery in the home, supported by a parent. So we're again, COVID has delayed a lot of things, but by essentially forcing many of our research programs to pivot to online delivery platforms, I think what we're actually going to see from that is a more rapid pace when these interventions will be available more widely. It's far easier to scale up a virtual intervention that's available online directly to schools and or families than it would be to try and go in and train and deliver it in a way. So it's one of the program itself has also been it's included in a large cluster of health technologies, health innovations, and has received praise internationally as an example to be emulated in how research innovations and private sector partnerships can be used to drive innovation for improving health service and health products for children and families. So it's had international accolades, as well as being very well received everywhere they've tried to, and they're expanding. They have expanded the number of partnerships into other parts of Canada and now into the US, where we'll be seeing a greater and faster pace of generating the evidence base for the impact of the program.
I want to make sure we can touch on a complex issue that you've been working in. So last year, you and your team at Queen's University partnered with MyTax Canada and able to assess the impact of COVID on families raising children with FASD. And you found some surprising and unexpected results. And I know that Adopt for Life has been finding some of the same things. Can you tell us about some of the results you found?
Yeah, and I'll say this is probably this was surprising to me. Yeah. I don't think it was as surprising certainly to the families and a number of service delivery professionals who worked with these families over the years. Yeah, the program, so KBHN and MyTax, which is another national organization that supports internships for graduate students and postdoctoral fellows in partnership with private sector, or increasingly now public sector entities. We partnered with them on a group of internships with community organizations across Canada, and Able2 was one of those. And they were aimed broadly at understanding the impact of COVID-19 on children with developmental disabilities and their families, and the partner organizations that we were working with. We were specifically trying to help Able2 evaluate their pivot to online support groups in place of the in-person programming that they had done previously. And that involved surveying families who accessed those supports, and then also doing interviews with them. And what clearly came out in both the surveys and most particularly in the interviews, with the one-on-one interviews with families, is that that COVID-19 had a devastating effect on their families in multiple ways. But what was particularly distressing was that children with FASD both were showing regression and a return to behaviors associated with earlier trauma in their lives. But there was also an increase in aggression and dangerous behaviors in the home, often directed towards other family members. This was highly frequent. Virtually all of the families that we interviewed reported some degree of escalation of aggression and dangerous behavior. Some to the point where, as it turned out, these were primarily adoptive families. Some, unfortunately, a fairly high frequency, that were actually facing a breakdown of
Yeah.
the placement of the child. And in a few of those, that child had been in the family for years.
Yeah.
And that the trauma of that and the devastation to the families is something I can only imagine. But for it to get to the point where they would feel that putting the child back into care was their only option
Yeah.
was a direct consequence of the withdrawal of support that occurred because of the pandemic. And this was clearly a problem here, but it was not isolated.
No.
We found similar, or actually have had similar reports in other populations in other areas of the country, and children with other types of developmental disabilities. So this is something that's very serious. It's devastating on families, and it's and once you hear this, I go back to the Kids Brain Health Network wants to be seen, wants to identify problems that address the needs of kids and families. This is clearly an urgent one.
Yeah.
This is a crisis, and so we supported, sponsored the National Coalition on Aggression by Children towards Family members that has been meeting over the past 3 or 4 months to look at this issue, to try to define it within the Canadian context, to talk about potential solutions and where we need to go. So this is an example, I think, where the partnership between a research network like the Kids Brain Health Network and the private and public sector service side and families can come together to create the best way forward for that. And that's what we're going to be working towards.
Right. We're going to run out of time. I just want to give you a moment to talk a bit about your upcoming conference in November.
Well, thanks for the opportunity for the plug. Yes. So yes, the Kids Brain Health Network holds an annual brain development conference every year. Last year, we had to do a virtual conference, and it was decided that this year, because of ongoing uncertainty, we're also doing a virtual conference. It's a 2-day event, November 8th and 9th. We will feature, I think, an exciting lineup of expert speakers who actually, again, the virtual world has made it easier for us to access speakers internationally. And so one of them will actually come to us from Australia. But we'll also be featuring our trainees in both poster sessions and lightning talks. And what's one of the new features of this year's conference is an increasing presence, active presence of families. So we created a category presentation to be given by families or family members in the conference, and I'm pleased to say we had a good response to that opportunity. And so we'll be hearing more directly from those families and in some of the sessions. Our research presentations, we're featuring 4 of our research teams in a partnership panel. And again, this will bring the voice of families forward to help identify the problem that is being tackled by the research team, and how we are working in partnership with various sectors to address those problems and those needs. The theme of our conference is affecting change through partnership in research, and we deliberately put the first emphasis on the partnership, because, as I said earlier, this is where research innovations need to live in order to have impact. We have to work directly with partners who will take ownership of the research outputs, the new knowledge, and put it into action. And that's when we start to see change for the better happening for families. So that will be the theme and topics that are discussed over the 2 days. I think it'll be a very exciting and informative and interactive. We will make this as interactive as possible and accessible. We want families to access the content.
Right.
And so we created a special category of registration for family members that is deeply discounted. I think it's $25 to register for
very reasonable.
the full 2 days of the conference. So encourage people to, I don't know, I think I actually put could I put the conference website in the chat? Would that be okay?
Yeah, I did already. I put the link
Perfect.
for it
Okay.
there. And that's great that you added that, because I was going to ask, is this intended for families and caregivers? And then, so that's great. So yes, it is. And you have your own category and it's very affordable. So I think that's wonderful.
Yeah.
So the link is there. Check it out.
And Chantel, were there any questions for Dr. Reynolds? I know he has to hop off any minute.
I know, no specific questions. I think all that information and the discussion that was brought here today was just comments saying that it's much appreciated. And obviously the link to the website is there if they want to dig in further into the different programs and reach out to Kids Brain Health Network. All the information is there. So I'll just take our last 2 minutes just to thank you for taking time out of your very busy schedule to join us. Nancy and I both appreciate it, and so does our community. And we'll be keeping tabs on what you're doing and checking out the conference for sure.
Well, I very much appreciate the opportunity to connect with you and the broader community. You are why we do this. Effectively, and I've often, when I talk to families directly, and the fact that you give your time to help support our various research programs is greatly appreciated. I have to say, you folks are my heroes for the things that you do every day for your kids. And so anything that we can do as a network to support you, that's what we're here for.
Very well said. I agree. Thanks again, Nancy, for taking time out of your very busy day and jumping in and being our host. It's always a pleasure to see you and have you on Snack and Chat. Next week, we're wrapping up our month-long awareness campaign for FASD with 2 members of the FASD Adult Leadership Committee from FASD Changemakers. So you don't want to miss that episode. It's going to be fantastic. Wishing everyone a great day and a great rest of your week. Take care of yourselves.
Can I give one last plug? Because I forgot to do this.
You may have the last word. You may have the last word.
Well, as everybody knows, we have a new or not so new government now. But Children's Healthcare Canada led a campaign, and Kids Brain Health Network and a number of other, many other organizations across Canada that support children put a full-page ad in the Globe and Mail today. It was a call to action for support of children.
Wow.
That link will be available. That story will be available. If you want to help spread the word, make sure that your newly elected MP or re-elected MP gets a copy of that and understands that there's broad support. There's been increasing recognition, but it's been slow to come. The children were largely ignored, if not abandoned, during the pandemic. That's going to cost us. It's going to cost us a lot as a society in the future, because of the trauma and stress that those children and families have experienced. It's time to step up and support children, and we need that message said loud and clear across the country.
Okay.
Well, we'll leave it at that. Thank you, Dr. James Reynolds. Thank you, Nancy. I don't want to go after that. That was very, very well said, very powerful. So,
Okay.
All right.
I'll stop
Bye,
Thanks so much.
Thank you. Have a
Bye.
great day. Bye.
Bye. Thanks again.